Auzubillahi minasyaitonirrajim. Bismillahirrahmanirrahim. Today I would like to present on the topic strong family values and physical environment of neighborhood, Malaysian elders' aspirations and preferences for living. I am Associate Prof. Dr. Nur Adha Abdul Hamid, co-authors with Nozulfa, Muhammad Farouk, Sharifah Hana, Muhammad Hafifi and Mashita from Kolej Universiti Islam Antarabangsa Selangor. This presentation is for the 4th ASNet International Multidisciplinary Academic Conference, IMAC 2021. Okay, the outline of presentation is on the abstract, introduction and problem statement, objective and methodology, analysis and discussion, and also the conclusion. Okay, now we comes to the abstract. Okay, there is inevitable aging. By 2030, the steady rise of the elderly will make Malaysia an aging country. Malaysians historically practice the custom where the elderly co-reside with their kids. The strong family values among family members make older people strongly believe that in the elderly, the family will take on filial responsibilities and take care of them. Nevertheless, the social characteristics of Malaysians have also steadily changed in tandem with increased urbanization and modernization. So this research is therefore aimed at researching the housing aspirations of the elderly in Malaysia, and elderly, as we know, their perspectives are varied. Okay, the introduction and problem statement. The Malaysian Social Welfare Department (JKM) takes the definition of senior citizens declared at the World Assembly on Aging 1982 in Vienna, namely those aged 60 and above. And the National Elderly Policy defines the elderly as individuals aged 60 and above. Okay, as the Assistant Professor Rikia Matsukura from Nihon University in Japan defines the aging population phenomenon into three characteristics, namely an increase in the number of senior citizens and a decrease in the number of young people, a decrease in fertility, and a decrease in mortality. In 2014, Shipra Singh in their studies and others in their studies referred to the elderly as individuals who are in a phase of life that is deficient in terms of physical ability, deterioration of mental ability, and gradually leaving a role in social economic activities gradually and moving to economic dependence status. According to data from World Population Prospects, the 2015 revision United Nations, in most countries and regions, the number of older people has increased significantly in recent years and growth is expected to accelerate in the coming decades. Between 2015 and 2030, the number of people in the world aged 60 years or over is projected to grow by 56%, from 901 million to 1.4 billion, and by 2050, the global population of older persons is projected to reach nearly 2.1 billion. The Convention on Rights of Persons with Disabilities and its optional protocol was adopted on 13 December 2006 at the United Nations headquarters in New York, and it sets out the legal obligations of states to promote and to protect the rights of persons with disabilities in society and development. For example, under Article 9, on the accessibility, Article 19, living independently and being included in the community, Article 20, personal mobility, and Article 25 is on health. Okay, now we comes to the objective and methodology. Okay, the study aims at researching the housing aspirations of the elderly in Malaysia. Elderly people's perspectives are varied, therefore recognizing the diversity of different ways involves a thorough study of the elderly. And the methodology, approximately 26 literature reviews on the topic and issues were included in the analysis, and this thesis uses qualitative approach, adopts library-based research, and by content analysis of documents, applies the literature review approach. Okay, the literature review, based on the Convention of Human Rights, family can be defined as basic societal unit, and the task of the society is to offer all the necessary support and protection to the family. Okay, the way we define family depends on cultural values, the social, economic, personal, and political context. According to Zitra et al. 2015, the family should be viewed as influenced by the social, cultural, political, economic, and historical context of the time. And in the contemporary society, considerable changes took place in the society that also has determined the way we define the family. According to Sonawat 2001, the family is a basic unit of study in many social science disciplines such as sociology, psychology, economics, anthropology, social psychiatry, and social work. The UNESCO 1992 report stated that a family is a kinship unit that, even when its members do not share a common household, the unit may exist as a social reality. According to Hodgson et al. 2002, family depends on whether it is being interpreted in a social, biological, cultural, or statistical sense. And according to Rahul Sharma 2013, there is a proposed redefinition of family and a proposed scheme of classification of family structure to try to match the pace of change of current societies. According to Wolf and Casper 2006, the strong family values will normally reflect on the family care, and the family caregiving to impact older people has become increasingly common as life expectancy has nearly doubled over the past century. And the promotion and preservation of the rights and dignity of the elderly and their full involvement in society are an important part of the pursuit of the 2030 Sustainable Development Agenda, which guarantees that no one will be left behind. Leave no one behind is actually the transformative promise of the 2030 Agenda for Sustainable Development, and represents the unequivocal commitment of all United Nations member states to eradicate poverty in all its forms and discriminations and exclusion, and reduce the inequalities and vulnerabilities that leave people behind and undermine the potential of individuals and humanities. Okay, on the analysis and discussion, Ismail and others 2020 found that senior citizens in Malaysia for some reason intend to move to another place and live independently or move to another type of residence that is more suitable for them to occupy. However, they still hope to stay close to family members. Muhammad Nakiyuddin Muhammad Mansur 2016 bring an example of retirement village in Sri Seronok Retirement Village located in Cheras, which is also the first retirement home in Malaysia but does not actually meet the standard for retirement homes. The proposed retirement home has active and health facilities and is open only to residents aged 65 and above. And in addition to that, the design is environmentally friendly for seniors, meets the lifestyle of seniors, and is friendly to health screening and care. Nur Shakiran Akmal 2017, through the findings of the study, found that senior citizens in Malaysia are more comfortable living alone in their home than living with their children. However, Siti Uzairia 2019 have proposed the guidelines framework for aging in place population in Malaysia. The developed framework consists of the key themes and sub-themes that are related and complemented each other, inclusive of the connecting items such as housing, social facilities, and services. Nadira Nordin and Hitoshi Nakamura 2020 have the objective and subjective influence of the physical environment of the neighborhood on physical activities of senior citizens in Johor Bahru. So this study proved that high density housing environment is not suitable as a place of origin for the elderly. According to Jordan Lim 2020, design parameters such as low hazard, minimum physical effort requirement, usage convenience, flexibility in use, and a good line of sight are critical when it comes to designing a home to meet senior. And according to Yuan Mei Kang 2017, a senior citizen or retirement village is a planned area where within its boundaries elements of accommodation and support services exist. Okay, now we come to the discussion on Plan Malaysia, better living in a safe and protected environment. This Plan Malaysia is under the Federal Department of Town and Country Planning, Ministry of Urban Wellbeing, Housing and Local Government, which is to protect and to guarantee seniors living in a safe and protected environment. Okay, there are 6 planning principles that have been highlighted on these guidelines. Number 1 is on the harmony. Okay, the definition of harmony including layout planning, building design and settlement environment for senior citizens should be harmonious, able to create social interaction and have a local image. Second one is on affordable, means that deemed to be affordable, and this affordable housing financing comes from sources of savings, pensions and family expenses. Okay, the third one is on the communicative. It is the elder opportunity with the community to enjoy life together in terms of acceptance, association, interaction, sharing and shared rights. And beside that, able to communicate the information, the consultation, collaboration, and learning with the community and freedom to make decisions and choices, independent to continue living and gain privacy in life. The fourth one is on healthy. Healthy environments such as provide safe walking and cycling routes from one area to another, provide comfortable living space, safe neighborhood and healthy environment, provide recreational area facilities, places of worship and educational facilities, offering job opportunities and provide variety of healthcare services, comprehensive, high standard and cost effective towards achieving a healthy life. Okay, the fifth one is on the safe side. The development of senior citizen settlement should be safe from catastrophic risks such as erosion, landslide, flood, near electricity lakes and industrial areas, especially those at high risk. Placement in swampy, hilly and steep slope is also not recommended. Finally, is on the easy to access and user friendly, which means that elderly settlement should be easily accessible and accessible with public transport facilities. And this elderly settlement should also be contacted directly to other facilities such as hospitals or health centers, public parks and shop units. And the placement of the facility should be close and easily accessible by a network of pedestrian paths that are connected, safe and comfortable without any obstacle. Okay, so that's all 6 plan of Malaysia. Okay, as a conclusion, the discussion on the past studies showed various issues involving the residents of the elderly, and these studies suggest some improvement in the national strategy involving the residents of the elderly, including information and suggestion in helping these groups plan for a better old age. Efforts in realizing the golden age-friendly residence should be seriously taken care by the authorities and related communities to the elderly. As life expectancy in general increases, persons with disabilities who survive into old age can also be expected to contribute to the overall growth in the population of older persons with disability. This highlights the need for countries to take a longer-term approach to investing in the planning, design and development in order to ensure the inclusion and accessibility of the environment by working towards the objective of building a society that meets the needs and capabilities of all users. It demonstrates the clear need to start articulating policies and programs with regards to aging, which takes into consideration the cross-sections between aging and disability and how society can ensure programs and facilities designed to meet their needs. In the context of Malaysia and the global trend of population aging and disability, inclusive the broader policy considerations should be deliberated and further explored. That's all for the discussion. Here, the authors would like to express Our deepest thanks and acknowledge the Ministry of Higher Education as a research grant provider for the financial support through our FRJS project, which enable the authors to conduct the research. Okay, that's all. Terima kasih. Syukran.